you can go on TikTok, you can go on Instagram. There's a lot of good stuff out there and there's a lot of questionable stuff out there. So
Right.
how do you make a decision? One of the things that is happening is that Google has started YouTube Health, and they've done it really well in the UK, where they've partnered with the National Health Service and Cleveland Clinic and Mayo Clinic, and they vet organizations and they're drawing on doctors to become YouTubers that they have vetted. And for anybody else, that you're looking at, what are their credentials? What are they affiliated with, or what organizations? Are you hearing something pie in the sky, or are you hearing something that you're hearing over and over again? And most people, I think, go to a number of resources or number of sources. And I think that's a good idea because you want to see what the convergent validity is, if you will.
Welcome to the Future of Healthcare. I'm Frederick Kaufman, professor of journalism at the City University of New York and a contributing editor at Harper's Magazine. And for this session, we're here to discuss how to prepare to be an advocate for your own health. On today's panel, we feature Dr. Mitzi Krockover, a physician trained in internal medicine. Dr. Krockover is the founding medical director of the Iris Cantor UCLA Women's Health Center, which has been designated a center of excellence in women's health by the Department of Health and Human Services. She subsequently went on to become the vice president of women's health at Humana Inc. She invests in women's health technology companies and spends a great deal of time helping to mentor entrepreneurs, many of whom are women solving problems for other women, propelled to innovate through their own health experiences. She podcasts at Beyond the Paper Gown on any platform, and you can find her on beyondthepapergown.com. This program is the brainchild of Ben Lytle, a healthcare and business leader. He's a visionary, an entrepreneur, an author, and a speaker whose successes include serving on presidential and state healthcare commissions, leading health plan giant Anthem, the national expansion of the revolutionary Silver Sneakers Seniors Exercise Program, and most recently, launching an innovative artificial intelligence company to increase the productivity of healthcare and other professional endeavors. He is the author of The Potentialist, which is an amazing book about the future and what we can do to prepare ourselves to thrive. So Ben, can you start us off today?
Sure can. Well, just for those of you who perhaps haven't seen other parts of the program, what we set out to do was to say, here's the good things coming about healthcare, because there's an awful lot of good, and in my opinion, a lot more good than challenges. But also to recognize that we're in a time of declining population, and that's hitting the healthcare industry very hard, as there are fewer practitioners. They're retiring and leaving the industry faster than we can replace them, just as our population is aging and needing more care, and we're inventing more that we can do all the time. So it's a real challenge to access to care, and there are other problems as well. And then finally, how do you as a consumer react to that? Because you're going to have to do more on your own. That's just the way it is. We're not going to be able to have as free of access, as fluid an access in many cases. And so what do we do? We're lucky today, very lucky today, to have someone that I admire a great deal, and who is an established leader in women's health, but also she's a fabulous conversationalist and personality, as you'll see. You will enjoy talk. I've never had a conversation with Dr. Krockover I didn't thoroughly enjoy. And I'm going to call her Mitzi, because that's what we do when we're off camera. And it's Mitzi and Ben. So we're going to talk about it that way. So Mitzi, let me start you off by saying, just from your standpoint, just kind of recap what, if for the audience, kind of the things that are on the top of your head. Boy, here's some great things coming. Here's what I worry about. And here's what I think about if I'm a patient sitting in front of you and says, how do I prepare to take better care of myself, knowing that it's going to be harder?
Those are really three questions. So
yep, three questions.
Thank you for asking me to be with you today. Most of my comments will probably be focused on women's health, But since that is 51% of the population and we make 80% of the healthcare decisions and pay more out of pocket than men do for our healthcare, I think it's probably okay to do that. You know, the reason I got into investing was because there were women coming to me for my clinical expertise because they couldn't find solutions for their own healthcare issues. And that's what the light bulb went off for me. That's how we're going to really move the needle in women's health, especially through innovation. And that has really been borne out. And so one of the great things that's happening is that there's this entire, across the board, but certainly in women's health, what's called femtech. There's a controversy about that term, but basically women's health innovation. It's happening across the world, actually. There's Femtech Asia, there's Femtech Europe, as well as the United States. And what we're seeing is not only solutions, but we're also generating data. And part of that challenge has always been that there's been a dearth of information for women's health because we haven't done the research. And the other good thing is that the president just announced that the White House is going to have an initiative on women's health research, which is really important. Not a lot of details yet, but I've been on some group calls making recommendations. So I'm very, very optimistic. So with that data, again, we'll know, and we already are starting to know more by leaps and bounds, and you can really extrapolate that to the entire ecosystem. There's lots of innovation, there's lots of data being generated. The challenge is, and you probably won't know this, is actually communicating across entities. So insurance companies, employers, and healthcare systems, as well as the innovation. And then the third thing that's really exciting is AI. And, you're right in the middle of it. And the possibilities are significant. We're seeing it in radiology, making mammography better, and a better screening tool. But the challenge with AI is that, everything has a different side of the coin, is that it's only as good as the information it's drawing from. And so we know that, unfortunately, there's been bias in our data, if you will, that AI has drawn from, and also certainly for not only about gender, but certainly other groups such as African Americans. And so that's the big issue. So those are kind of the goods and the bads, and we can go into that a little bit more. The second part of your issue is what can we do? Or what are your questions? What can we do? By necessity, just as I saw these women taking things into their own hands, I think that most people, especially the generations that have come after us, want things now. They are, and they don't want to wait. And so what that has done, I think, has really increased the amount of direct to consumer kinds of opportunities, even to what we call point of care. So you can go into a drugstore right now and you can diagnose your diabetes, you can diagnose your UTI, your yeast infection, pregnancy, and you can, other than the pregnancy, you can treat it. And now we have over-the-counter birth control. So that will, that's important. And what we're also seeing is, again, the advent of telehealth. So people want, so the access is somewhat increasing, and the avenues to get help is increasing. There's also a lot of health information on the internet and on the networks, and we can have a whole conversation about how to get more credible, make sure that the information you're getting is credible.
Right.
But so I think that, people are getting used to kind of taking things into their own hands a little bit, or bypassing because they're not in a 9-to-5 world. And so they want it when they want it. The third thing is that I feel is important is the challenge with, as you alluded to, the healthcare industry. We know that after the pandemic, or I know we're kind of still in the pandemic, but right afterwards, the big emergency, 1 out of 5 physicians left practice. We have 50% of our counties in the United States that are considered OB deserts, and which means that there's no OB care at all, and that means no GYN care as well.
Right.
And again, the access from a telehealth standpoint is positive, but it's not enough because our maternal mortality rates are the worst of the developed world, and they're getting worse. And on top of that, we have policies that are playing into politics that also impact not only reproductive health, but access to insurance. And I could go on and on. So I hope I touched on some of your questions.
No, you did. Yeah, you did. And I asked you an awfully broad question, and we've got time to go in them more specifically. Let's talk a little bit about when the statistics you just gave, I think, are probably staggering to anybody that's never heard them before. They're just staggering, and because people assume otherwise, and a lot of people I still speak all the time, and people go, "What do you mean population decline?" They've either never heard of it or they assume it's some distant 20 years from now. And I go, no, right now, go try to book a specialist. And you're probably going to be waiting a couple of months. And if your condition is urgent, it's right. And so so that's the world we're in right now. And it's unfortunately, as you well know, Mitzi, it's not going to get better sooner except through AI that we can figure, and technology in general. I think technology in general, particularly AI. And of course, we have all of these concerns that have been raised, some legitimate, some really not. It's just fear mongering. And so, but the reality for folks is, and it's probably one of the better things as they think about it, we can say to consumers tonight, is you are going to have AI in your healthcare, and you're going to want it because it's going to enhance it in most cases, in virtually every case. And in some case, it's going to be the only way we can free that doc. We've got to make multiples of that doctor, every doctor and every nurse. They're all spending time doing things that are not patient care, and we got to get it 100% patient care. So I think that's a background here. Let me ask you on how practical and how important is it for particularly women and women's issues to follow somebody like yourself, follow people who are cutting edge in this? Because it seems to me the one thing about women's health is there's a lot going on in it, a lot written about it. And you're somebody that, I recommend to all the women in my family, follow this lady. She's well worth paying, and they're doing it. But what else can they do? What other sources would you say are good, credible women's health sources for people that just want to say, hey, I just turned 40 or I'm 45. I don't know whether I'm doing the right things.
Sure. Well, first, I want to take a moment, if I can, to define women's health, because I think everybody has a different idea when we say women's health. Mm-hmm. And historically, I think most people have thought about it as, and not to be trite, but bikini medicine, reproductive health issues.
Right.
And as an internist, I have a much broader focus on it. And I've been really heartened because the rest of the women's health community has also really adopted this kind of mantra of that it's those diseases or conditions that affect women or manifest differently in women, like cardiovascular health. Certainly, we have different symptoms, for example, which may mean that we need different diagnosis and different treatments. Those that are disproportionately represented, and that can be Alzheimer's. 66% of people with Alzheimer's are women. 80% of people with osteoporosis are women. And there are autoimmune diseases that are also predominantly women. And then the third bucket is those that are exclusively or nearly exclusively present in women, that obviously all the reproductive health issues
Right.
and breast cancer, for example. So when I talk about women's health, that's what I'm talking about.
So you're talking about very specific diagnoses, very specific conditions that only women have, or they have in a greater proportionately than men, right?
Yes, and the appreciation that women's health is not just little men's health, if you will.
Right.
That we're not just little men.
Right.
It wasn't until 1993 that the NIH Revitalization Act was enacted in order to mandate that for NIH funding, you had to have underrepresented groups, including women. And so again, we're just catching up now. So
Yeah.
now I've lost what so you're talking about information. So what
Right.
I would like women to know is that it's not just, like I said, bikini medicine. It's even how your heart, knowing about that
Yeah.
cardiovascular disease is the number one killer of women.
Yeah.
That lung cancer is the number one killer in terms of cancer for women. That's not a women only disease.
Right.
And so forth. So that with that mindset, and that's what we do on the podcast, is talk about issues writ large and all those factors that impact on our health. Other sources are, you can go on TikTok, you can go on Instagram. There's a lot of good stuff out there, and there's a lot of questionable stuff out there. So how do you make a decision? One of the things that is happening is that Google has started YouTube Health. And they've done it really well in the UK, where they've partnered with the National Health Service, and they've other like Cleveland Clinic and Mayo Clinic, and they vet their organizations, and they're drawing on doctors to become YouTubers that again have vetted. And so that to me is one way. And for anybody else, that you're looking at, what are their credentials? Where they what are they affiliated with, or what organizations? And are you hearing something pie in the sky, or are you hearing something that you're hearing over and over again? And most people, I think, go to a number of resources or number of sources, and I think that's a good idea, because you want to see what the convergent validity is, if you will.
Okay. Very good.
And then the other thing that's happening is that, especially with menopause and perimenopause, a number of companies have come up that are doing consults. And a lot of that is really just pure education.
Yeah.
And I think why women are so excited about some of these things is that, and if you look at, it's really interesting, if you go to Reddit, the subreddit for menopause, if you go on Facebook groups and other communities, people are like, oh, I thought I was the only one dealing with this. And, I go to my doctor, and my doctor, told me, it wasn't anything, or whatever it is. So that's another source of, going to those communities is great, as long as you take everything with a grain of salt. And what we always say, and a lot of doctors have started to say this: bring your information that you get from other sources, whether it be from your mom or your or Google Health, to your doctor's office.
Yeah,
and
that's a great idea. That's a great recommendation.
Yeah.
Got to get
well,
that.
It's hard because
Yeah.
we only have a certain amount of time to see patients, but a lot of I did a interview with this influencer physician on YouTube Health. She's got 2 million followers, and she's lovely, and is a practicing clinician. And she says, I want them to come to me with those, so that it's a teaching moment. I can tell you why it's good, why it isn't. And that's what, I did in my practice as well.
Yeah.
It's a good
That's
tool.
a great idea. One thing that because me being in healthcare so long, people assume I'm a healthcare, and I always remind them I do not have a license to practice medicine, and there's a reason. But I know a lot about the system. They say, well, what should I do? What does self-advocacy mean? And I said, well, one thing is there is a lot, not only of information, but there are a lot of devices continuing to come out. The Aura Ring, the Apple Watch. I mean, me too. I mean, I swear by it. And those are really effective. When I was running a prevention and wellness company, and the one that Axia, the one that took the silver sneakers product that this very bright lady named Mary Swanson created, and we helped make it national, working in partnership with her. We dreamed, this was 2004 to 2006. Our dream was this ring. Yeah. Because for the first time, you get instant feedback about, and that was what, we knew that's what works when you're trying to change behavior and you're trying to monitor your own health, when you can do it right then. And so like with the Oura Ring, for those of you who don't know, it's not terribly expensive. I think it's $300 purchase or something like that, $7 a month. It's everybody can't afford it, but most people can. And it monitors your heart rate 24/7, tells you how well you sleep and why.
How well you don't sleep.
Right, how well you don't sleep. Yeah. And it monitors your stress levels. It will help you, motivate you to get more steps in every day, because it counts every step you take. And you'll look down and go, wow, I got 6,000. I just been working around the house. I'm going to go walk for 20 minutes and break that 10,000 mark. It really works. And the smartphones or the smart watches are the same way. And so that's an easy one for people to do, and it really works. I mean, I've seen so many people's behavior change. The other is take someone with you when you go to your appointment, particularly if you've got a condition that's threatening. We're embarrassed. We're all private people. We don't really want to share that. But if it can be somebody that you feel comfortable with, your mother, your sister, your spouse, a partner, really helpful, because in those moments, and I don't have to tell you this, I'm sure you experienced it 1,000 times, you think you hear, but you don't hear so well. And even if you take the notes, you're nervous, you're tense, and very often, then if you forget when you leave, you're embarrassed to call back and say, I forgot what you told me, or I didn't understand it, and this really helps. I find that when people, friends and relatives, have had really serious diseases or something threatening, myself included, that's invaluable.
And you talked about the wearables. Mm-hmm. A lot of doctors are now incorporating the data from some of their patients' wearables in order to see how is your blood pressure, how is your heart rate, and that kind of thing, over, outside of the doctor's office, which can be a kind of an artificial environment.
Right.
And, I think that's a huge issue. You talked about self-advocacy. I think for women, it's especially important because not everybody, but a lot of women feel dismissed in the doctor's office. And there's a couple of reasons for that. Number one, we're only as good as the information that we're taught as physicians. And if we didn't have that information, we don't have it. If the research hasn't been done, it doesn't get into the journals, doesn't get into training, and then doesn't get to the bedside. And so I think it's frustration mutually in that we don't have the answers. And then women feel dissatisfied and sometimes dismissed. And so what we really need to encourage is, if you don't just take no for an answer, if it doesn't feel right. And, and then maybe, again, going to some of these sources that we talked about, just to check things out. The average woman with endometriosis waits, I think, something like 7 years and 5 doctors, or I'm not sure I've got the exact statistics, but something like that, just to be diagnosed. And by that time, there could have been intervention. The other thing is that we don't talk a lot about what you should do when you're in the hospital. And, and the hospital's changed a lot.
Oh, yeah.
Since I've practiced, there's hospitalists there's even hospitalists to deliver babies. I had a great conversation with an OB this week who is an OB hospitalist. And so that means you don't have your primary care physician there who knows you. And again, it's the care is only as good as the communication between that hospitalist and your provider. And that hospitalist doesn't know that maybe, you danced. I again interviewed this wonderful hospitalist who talked about the fact that family is so important when you're in the hospital, especially if you're not able to speak for yourself. And she had a patient who, was elderly and frail, and she really kind of thought was her status quo. Ends up that the woman was dancing. It was a dancer and was very spry and active as much as a few months ago. So that was really important information. And so I think that that's really important. And also to question if there's anything that doesn't seem right, to maybe call it to people's attention, because mistakes do happen.
And I want to contrast, and then I'm going to generalize here, so hopefully I don't offend entire countries when I say this, but I spent a lot of time in other systems, not everywhere in the world, but I've visited a few with the idea of looking at it through the patient's eyes. And the United States, believe it or not, is much farther along than most of Europe, UK, and in particular a lot of countries in South America in being willing to challenge or question and be your own advocate. So because many of them it was a government provided program, that's what you got. And unless you had private insurance, you didn't even feel like you had the right to question. So they've been much quicker to just accept. So we start from a little better base, but we still got a long way to go. And I think, Mitzi, you really hit on probably, again, like some of these really important fundamentals that when we recap this program at the end and the advice, we got to make sure that's on there, which is advocate literally means advocate. It means,
but if I can just break
please.
in for a second and play devil's advocate here to
Please.
return to what Mitzi was saying about a woman with endometriosis, to talk about, who are those patients and look, I don't like the doctor. I don't like going to the doctor. I don't want biofeedback. I don't want to know how many steps I've taken. I'm not going to wear the ring. And you know what? I'm not alone. There are a lot of people like me who are outside of the system, don't want to go to the doctor. How do you reach them? I think that's a big question, because there are many people, they say they have pains. They don't want to go to the doctor. Maybe they wait 5 years. I think there are probably
believe me,
out there. So what's the solution there? Those who don't advocate.
Yeah, there are people. First of all, thank you for bringing that up, Fred. I'm going to talk about men's health for a minute. There is a disproportionate number of men who somehow think not going to the doctor ever is a good idea. And I don't know what to tell you other than that is a very, very unwise decision. So there is but and that does really, there are a lot of men that really, but it's not exclusively a men's issue, but this is where the reality of the 21st century is coming home to grip. It's always been true, but now it's especially true. Real easy rule: early diagnosis, slow to carefully make your treatment decision. It never hurts to find out where you are.
Sure.
Then you got a decision to make. So you go ahead, Mitzi, please.
Oh, sure.
Thank you. That's a great question.
Yeah, it is a great question. And I can tell you stories about some of the men that I treated. It's really interesting. And it's really interesting because men, again, gross generalization, they just want the answer. You guys, you don't want to spend a lot of time there. You want to go in, get out, and all of that. And women do tend to, have a conversation and need different things. So I appreciate that perspective. The challenge is that, and people have said this a lot, our healthcare system is really the sick care system, right? And
it's remedial.
And combining that with what you talked about very early, the fact that we don't have enough healthcare workers, and that's not just physicians, that's nurses, that's
everything,
and all of that. And now we're getting pharmacists working at the top of their license, at drugstores giving us shots and all of that. So that's one, we have to find a different way than just going to the doctor. And so it's interesting that you said that you don't want to know about your biofeedback and all of this. It's really interesting because I think that that's what drives a lot of people from going to the doctor, because they feel like if they can monitor it themselves, they have more ownership of it and they can kind of see over time. And it does change behavior if it's, done right. And then I'm going to again slide into what you and I talked about yesterday, Ben, is the importance of prevention. If you don't want to go to the doctor and you don't want to be sick, then we really need to, and we as a society need to be much better about encouraging preventive practices, and both in our workplaces as well as our homes, because 80% of chronic conditions could be eradicated by preventive lifestyle. And as you well know, 20% of our sickest people take 80% of the healthcare resources that we have. And and I think you're seeing this through the pandemic, that people were at home and they said, I don't have to run to go to the office. I can do things on my own. This lifestyle may be is less stressful. All of those kinds of things I think are starting to, especially again with this next generation, hopefully taking better care of ourselves. But we also, again, have a long way to go.
Well, and I think, Fred, directly answering your question, and I think it's an excellent one, is the one thing about the democratizing world we are in and the future is you really do have to look out for yourself more, but you're going to have more tools to do it with. And if you want to make the decision, if it's free world, you want to make the decision, I don't believe in doctors, I'm not going, I'm not doing any of this stuff. Welcome to a shorter life or a longer life, a lot of which is going to be under intensive care as an older person. So
but my question is
I think there's a way. Yeah, go ahead.
It's more about communication. I guess that's what I'm trying to get to. It's welcome to a shorter life. It's like, how, in other words, how does this word get out? Is this a government responsibility? Is this private practice? How are people supposed to know, for instance, ask the artificial intelligence doctor. Where is that doctor?
Like, well, it's not there
yet. What's the program here as a consumer that I can do to become a more educated consumer and to alleviate my sense that, I don't want to go to the doctor?
Well, here's the thing. Compare today to what, even today, before we have artificial intelligence fully integrated into the system. Today, I've at least got the internet and Google, and I can find out more about medicine today than I ever could just 20, 30 years ago. So, and it's coming fast. Very soon, you will see ways to go on if you have a specific condition and get self-educated even more, because you'll be able to talk to an artificial intelligence version of Mitzi Krockover and be able to ask Mitzi questions about your condition, about the whatever condition you have, whether it's menopause or whatever, and it'll feel like you're having a one-on-one conversation. That's going to be huge. That's within 2 years. That's going to happen. That's an enormous step forward. And I think that's going to help a lot. One of the things, though, is it is going to come from the free market. It's going to come from people like Mitzi who have a passion to reach out to and help women. It's going to come from people like me who are doing this stuff today creating this webinar to reach people and say, hey, think about these things. And we're going to, at the end of this program, we'll have a list of things for you to check off and say, okay, I can do that on my own. So but it's not going to come from government. They're going to do some good things, but the days of the government's got its, they're struggling to just adapt to the changes coming in everything. And so it's going to be much more free market, people seeing either because of a cause, like Mitzi's doing it, like I'm doing it, or people who figure out, hey, I could make a buck with this thing, and that's okay. That's okay. So the Oura Ring, that's a perfect example. Somebody had a great vision, and there are lots of those kind of things out there. Hopefully one day we'll have a very easy blood pressure test. We're not much, at least that I'm aware of, Mitzi, maybe you know of one, where you still got to do something like a cuff. We don't have but you can't wear a ring and it tell you what your blood pressure is. But that's probably one that's coming. Doing more home blood tests, things like that, urine tests, all that stuff is probably coming within a decade.
As you're talking about this, I can't help but think though about lower socioeconomic populations that, and maybe even lower education, that may or may not even, have access to the things. And where I do think government has a place, but also other entities that are stakeholders are also employers.
Yeah.
And obviously, because we are an employer-based, basically healthcare system, that's who pays for insurance, maybe less so than previous, but still significantly. Employers are wanting to cut costs, as they always have. And now there's so many innovations that are coming to them saying, I'll help you with your diabetes patients, or I'll help you with your menopause patients, and and all of that. And so that is a good source. And so what we're finding is that a lot of people don't even know what their benefits are. And so one thing I would say is that if you're an employee of a corporation, or even small or large, find out what you have access to. You may have some of these programs. You may have, other, even policies such as family leave, maternal leave, that kind of thing really does impact on health. And so you've got employers and insurers potentially providing some of that. And then the government can do a lot in terms of, just as they have quality control, quality requirements for physicians, we could have lifestyle requirements for people, right? And there have been.
You're on a slippery slope. You're on a slippery slope right there.
Well,
I know, but employers have done that.
Right,
they will give. It's not so much a stick as it is a carrot.
Yeah,
if you can reduce your blood pressure, if you can reduce your weight, you'll get something.
And I think, Mitzi, one of the things that I want to make sure that everybody heard what you just said, and we'll elaborate on that, because it's going to be, I think, in this final list. Whoever provides your benefits, you talk to them and make sure you know what they are. Whether it's your employer, Medicare, Medicaid, health plan, whoever you talk to, make sure you understand what your benefits are, because you may have things in there that can help you that don't cost you anything, or very, very little, that could be really substantial. I know, for example, I've got 2 family members in my extended family, which is getting close to being 1/3 of the United States. But so no, I'm teasing. But both of them, one of them has juvenile diabetes. So she got diabetes at 15 years old. She's now in her 60s and has managed that over all these years. And then I have another one who contracted. He was the ultimate man's man, right? And he got diabetes in his 40s and is now retired. And I asked both of them, compared to 10 years ago, what's it like to manage your diabetes? And they said it's like being on a different planet.
Yeah.
Because of the feedback, the technologies that, like you said, Mitzi, walk into any drugstore and you can get help, where before it was you had to go to the hospital if you could get it there.
Sure.
So I think that's and a lot of that was their benefit plans paid for those devices to help them manage it.
Sure.
And
I want to go back to Fred, because I'm really
yeah.
And I'm not done either.
question.
I'm not
No,
done.
no, no. But
Yeah,
the
good,
other
good.
thing is that I think that men do. I'm surprised that you said this, because I do think, again, gross generalization, that men do like, and women too, a lot of this feedback, because it's like the gamification of health.
Yeah.
And
that part they like, going and standing in front of a doctor, not so
Yeah.
much. And I'm really talking about the ones that I know, and there are far too many, who absolutely will not go to a doctor.
But
yeah, that's why home.
That's scary. Yeah.
there are three things. There's standing in front of the doctor, right? There's the
Right.
gamification, neither of which I like. But
Right.
then there's a third thing, which I like least of all, which is talking to my insurance.
Oh, yeah. That's
Now,
wait a minute. You
let's
just
be
said
honest.
And you
something
talked to two
impossible.
former insurance executives.
Let's be honest here.
Right.
What can the insurers do to do a better job communicating, so that my worst nightmare is trying to get on the phone and talk to my insurance, my health insurance. It's
Right.
everybody's nightmare. What has to be done here?
Well, again, I think first of all, and this is, I would say this is true all across the service sector right now, but it's particularly true in healthcare, because in healthcare we got to have an answer right now, So, but there has been an increasing complexity in the business. More regulations, more changes, more benefit plans, more innovations, and they're running like crazy to get that up. And then the poor people on the phone. And I can tell you, when I ran Anthem, was a long time ago, but when I ran Anthem a long time ago, we put our very best people on the phone, because they were the ones who had the most knowledge and had the personality. At least, most of them had a personality. As those jobs, which are classified, generally thought of as highly skilled administrative jobs, that is one of the areas that has been hit the hardest post-COVID, because a lot of people that left the industry had years and years, just like the nurses and the docs, they had years and years of expertise, and suddenly they're not there. Everybody is understaffed. Now, the good news is, one of the places where AI has the fastest potential improvement is in this area of customer services. Because essentially we can create an artificial intelligence customer services rep that knows everything about our benefits. Impossible for a single human being to do that. And they know everything, they never forget, and they're always empathetic. And that ends the phone tree problem, because you have a limited number of people, but we can duplicate that customer services rep 1 million times, if you follow me. There are 1 million copies as easy as there are one. And so that's the breakthrough. Again, I think you're going to see that. That is what's going to save the customer services side of all the services industry. This last summer, I spent a lot of time in Europe, and I spend time there a lot and travel around, and I heard over and over and over again from hotels, restaurants, we're dying for this. Same problem. There's a level of complexity in our business that's gone up, and the number of people available has gone down, and the knowledge level of the people's declined. And so it was one apology after another. One situation you'll get a kick out of. So, but thank God it was not healthcare. They lost the luggage in the hotel. So we had the Apple tags. We knew they were in the hotel. They couldn't find them. So that's a service issue. And the guy he was almost in tears, the manager saying, I'm so sorry. This is what we're dealing with. And it's really difficult. So I think generally it is a problem of complexity and availability of manpower. And the only solution I can see is technology, and particularly AI.
But can I ask Mitzi a question then, since we're
Sure.
really focusing on AI and we're really focusing on technology? Is there a gender difference between the way men and women will react to dealing with the technological interface as opposed to the human face?
That is an excellent
It
question.
is. That's a great
And I
perceptive
don't
question.
know the
Don't know.
answer to that,
Yeah.
but I do think there's a difference generationally,
Mhm.
and I don't, there's basically the chatbot, the text interface, and it drives me crazy. For example, when you go on any kind of website and it says, "Can I help you?" and they want you to type out everything. I just want to talk to someone, right?
Yeah, right.
And so then fast forward that what you've explained, Ben, with respect to or described with being able to converse with an AI,
Right.
it ends up you kind of forget you're not talking to a
Yep.
real
Right.
person.
Yeah. And
Um,
that's also, Fred and Mitzi, the one thing that everybody, all the discussion you hear today about AI, the AI that is pervasive right now, the breakthrough that happened in the last couple of years, because it's 40-year-old technology. But what's really broke through in the last few years is what's called large language models, or the new acronyms, llamas. And what those are is, in short, you can talk to a computer and understands you and talks back. That's pretty freaking amazing, whether it's in text, whether it's in voice, and soon it'll be in video as well. And that's the breakthrough for the lower income folks, because now I don't have to have any technology other than a phone, and most people have a phone. And I can now just tell my computer or interact with the computer, interact about healthcare in a way that I never could. And right now we're all talking about AI, but the real breakthrough, that is a new brain to computer interface, is voice. I don't need a keyboard and I don't need a screen. That's going to revolutionize healthcare, education, everything like we've never seen before. And we're just, and ultimately, by the way, all of that stuff will be reduced to a chip. So when you walk by your thermostat in 5 to 10 years, you'll say 68 degrees until 10 o'clock, and then bring it down to 66. That's it. You don't have to touch it. You don't have to do anything. You just hold it. And that's because we'll ultimately reduce these large language models, not the complete model, but that very specified purpose, down to almost everything that's electronic. And that'll make it much, much easier for people. First of all, it's cheaper, and it'll make it much, much easier for people to interface.
Two things, if I could. Fred, going back to your question, because again, you really inspired some thinking here. Women and men do communicate differently. And there's a great book by Deborah Tannen called You Just Don't Understand. And then she's written a lot about the differences between men and women in various environments. And when I first read that book, I had this aha moment as a physician. It's like, that's what's the difference. That's the problem. We're speaking different languages in that, again, going back to, and I was really referencing her work, men in general just want the facts, ma'am, and give me the answer. Whereas as a physician treating women, I'm very much talking about the kind of how I'm getting to that decision. And they like seeing that. And I had a colleague that said, you know what, if I said that to my male patients, they'd like shoot me. They would get rid of me because they don't want to hear that. It sounds wishy-washy. So it's really interesting in terms of the AI that Ben's talking about. Will it be satisfying enough to women?
Right.
Because there's reflection, there's whether or not there's eye contact, whether there's feedback. And that leads me to another topic that we haven't talked about, and that is mental health. And so what's really interesting is that where this whole texting and chatbot kind of thing has been relatively successful is in mental health, and not just the telehealth. And I think that's going to be really important. There is I can't remember the name of the app that a woman who was a young woman at the time in Russia developed because she was just wanted somebody to talk to. So she made a chatbot, and then she put it on made it available commercially. And it had like millions of people. And to the extent that, going back to kind of your question, people would take it on vacation because it was talking back and forth to them. They had a relationship with this bot.
Right.
It was so empathetic and
there's huge opportunities here, enormous opportunities. Matter of fact, I've got a conversation this week with loneliness and alienation, to have somebody, and one of the things that I'm advocating to the industry is always give people the opportunity to press the button and talk to a real person if they want. Now, because that's what we all hate about phone trees, right? I can't get out of the darn thing. Like you said, I just want to talk to somebody. If 99% of the time we can answer somebody's question through the AI representation of a person, a real person, then I think that'll make most people happy. But you still want them to be able to say, I can get out of here. And it may not be immediate. That's part of what they may have to call you back, but that's okay. And I think it's, as long as we don't make it a closed loop where you can't get out of it, and that's going to be a company by company decision. But I think the better practice would be always give that to people, and they're going to, because at the end of the day, again, things that everybody doesn't always remember about technology, it can be the greatest stuff in the world, but if the adoption rates are low, you don't get anywhere. It takes forever. So we have to do stuff here that makes adoption rates very high. So in the company I'm working on, we emphasize, it's not exclusive, but we emphasize real people as the personality, so that I feel that human being on the other side, and it's not just a bot. And so I think that, again, then the whole idea is adoption rates, that I can feel more comfortable.
And the more adoption, the more the AI learns. So
exactly.
It's really a virtual cycle.
But I think, Mitzi, back to your point, I think you're right. One of the things, if so many people out there are developing these AI llamas, is really that we are going to have to work with you can make it speak any language you want, but that's not going to, you got culture, you got ways of communicating, and that's going to have to be learned over time.
There is a loneliness epidemic. We hear about this all the time, and clearly it's having some sort of ill effect on clinical, how people are presenting themselves.
Right. One thing, a story I'll share, though, to talk about really a technology that is really being successful, has been successful. Mitzi mentioned mental health. One of my collaborators on my books is an outstanding PhD therapist and a professor of psychology. And she said that most of her friends who are therapists and her associates are reporting that 80% of their patients do not want to go back to the office. And for a very good reason. Think about it. Nobody feels good walking into the psychologist's office. Even today, you'd think everybody, ought to feel fine about going, but people don't. And number two, nobody, particularly most people, don't feel good on the couch. But a Zoom is more intimate, and I'm talking to my therapist from my safe place, my home. And that's evidently having a big impact. So adoption rates there of e-visits went through the roof. And it's not the therapists that are pushing it necessarily, it's the patients. And I think there's some stuff to be learned there. It may not be all healthcare, but it's some healthcare that will feel better that way.
Well, I think also it's the convenience.
Mm-hmm.
You're not, schlepping back and forth. And also there's more availability as well. But I do think that that's an interesting point in terms of just feeling more open by
Right.
not having to come into the office.
Right. Right.
You'll bump into anybody,
Right.
it's much more
Yeah.
private.
Yeah. So I think if you everything a futurist does is about convergence. Where everybody else will straight line a trend, we're looking at trends as more wavy lines, and they converge. And when they converge, big things happen. That's what's happening right now, is we're getting a convergence of major trends, and that's accelerating change. And so one of the things we can really watch here that on the positive side is the fact that the communications tools are getting better and better. We're sitting here tonight on something that was hardly ever used before 2019. That's pretty freaking fast. And it is now a staple of business, healthcare, and everything else. And it's only going to get better, just better and better and better. And then we've got the whole AI thing that's going to allow us to multiply, make people more productive that are essential to us. And where before I could only have a certain amount of time of Mitzi's time because she's only got so much time to see patients. Now we can basically expand that, at least some of that conversation and patient education, basically limitlessly. And
So we're getting
the faster we can get there, the better.
We're getting close to the end of our session here. So we're talking a lot about trends. We're talking a lot about trends.
Yeah.
Quickly, let's do our final roundup here. Mitzi and Ben. Mitzi first. Right. Top 3 trends that we should be on the lookout for in terms of advocating for your own healthcare into the future. Top 3 trends, and then Ben.
Right. What do you mean by trends? What's happening now, or what I want to happen?
Yeah, what should we be on?
What to watch,
or what's coming up?
Sure.
What's in the future? What are we?
I think that the technology to make people more self-sufficient in terms of their healthcare is really important, and I think we're going to see more and more of that. And I do think it may be, again, maybe this is wishful thinking, that there will be more focus on holistic kind of approaches to one's own health, whether it be specifically, nutrition, exercise, that kind of thing, but also reduction of stress, the understanding that mental health and loneliness are important, and that I think there's going to be more and more focus on that with respect to not only individuals, but employers, and hopefully social systems as well.
Well, one thing, yeah, and for folks out there, I think it really is the changes we're going to summarize here at the end of this series. But start off with, I am my own advocate, and I'm a bulldog. I'm just going to be a bulldog. And then we're going to do, those of us in the industry that are passionate about this are going to do everything in our power to make it easier for you to get information that's going to help you with your specific situation. On this series, I'm hoping to publish some kind of an ebook that'll be $1 so that everybody can afford it. Here's a 20-page or a 30-page little book that says, here's how to be your own advocate. That's a starting point. So that's the kind of thing, and just know everybody right now, there's a lot of challenges out there, but there's a whole lot of people trying to come to the rescue, and I think stay strong. Stay strong. That's
well, there's so much more to say about this topic, but I think that's going to be it for this session. Thank you so much for joining us, and we will see you next time.